Thank you, Mr. Chairman. I just want to yield time to Chairwoman Foxx if she had some additional comments.
I do, Mr. Chairman, and I thank the gentleman from Kentucky. Number one, AHPs would be treated exactly as employer-sponsored plans. So if they choose to do maternity and newborn care, they can do that. And again, our colleagues are saying, if, may, as though things would be that way. But it's going to be up to the AHPs, but they operate in exactly the same way as employer-sponsored healthcare does. The other comment I want to make, and it just absolutely drives me insane, when somebody says that a benefit to the citizens is a cost to the federal government. Less money coming into the federal government is considered by our friends on the other side of the aisle as a cost to the federal government, as though everything we earn belongs to the federal government. So the $300 million that you're talking about, as Mr. Burgess rightfully pointed out, means more people are going to be covered, which means less money going to the federal government to pay the subsidies for Obamacare. But meanwhile, people get choices. And so it's all to the benefit of the citizen. It's less control by the federal government, less money going to the federal government, and that's good. So I think it's important that we point that out. And let me say, under essential health benefits, which we talked about a lot when Obamacare was covered, and we've talked about a lot in other things. You may have a business that is all single men, and they want to have health insurance, but they're being forced in many cases to do maternity and newborn care and pediatric care, but they don't need that. And so again, under choices that you're giving people, you're saying you don't have to pay for all of these benefits which the government deems are essential. That's probably all that I need to say before I get in trouble saying something else.
Well, I'll give you as much time as it takes to get in trouble. Chairman Smith, would you have any comments that haven't been addressed?
I think Chairwoman Foxx did a great job.
I would just say that there are people who are hard workers and they have no employers. There are hundreds of thousands of farmers, and they are excluded from these wonderful employee plans that for people who have bosses. Now, a lot of people farm because they don't want a boss, but and they're providing a service for society, but these association plans would allow them, I believe, to have the same benefit or access to benefits that people who work for corporations have. And this was a problem before Obamacare. It's a problem after Obamacare. I would just say that one of the biggest untold failures of Obamacare has been COVID. You didn't have much choice in COVID for the kind of treatment you were going to get. The government told the hospitals what they could do and what they couldn't do, and that's what you got. And I think that was a failure. But Mr. Yeah, I'll yield to my good colleague.
Thank you so much.
Legend
Kentuckians are always so kind.
Yes.
So
Don't abuse us for that.
So I think that there was a really important sentence that the chairwoman pointed out, which is if they choose to offer maternity care. And that is, I think, what our problem with it is we don't want employers, we don't want AHPs to say, we're going to choose not to offer maternity care. That was the idea of offering some basic sets of key pieces of healthcare that we need in this country. And so I think that I appreciated your answer, Chairwoman, because I think that highlighted the distinction. Thank you very much for allowing me to
Would you
yield.
indulge me for a question? Would you support this if they were required to offer?
I think one of the ways in which we could improve this, and we offered an amendment and Ed House Ed and Workforce, and every single Republican voted against the amendment to require that maternity care be offered. So it would have, it would be a different bill, but the Republicans in House Education and Workforce chose to reject that amendment.
Maybe we can fix that when this gets to the Senate.
I stand corrected. The Association of Health Plans do cover maternity and child care.
I thought they might. That's why I was asking if she would support the bill where they were required to. One of the reasons. Do they or don't? Do they or don't they? May, okay, not shall. Okay, thank you very much. And
Yeah, I think that's the issue of may versus you are required
Understood.
to. It's the optional choice.
I'll yield back.
Thank you. Gentleman from Texas is recognized for whatever questions he has for the panel.
No, one more clarification. They do